With plans for a partial resumption of in-person learning in the Boston schools, teachers and advocates are keeping a close eye on building safety and precautions for the pandemic. That includes everything from ventilation to protective equipment. To tell us about the preparations and the results of a recent walkthrough in school buildings is the president of the Boston Teachers Union, Jessica Tang. Thank you very much for being with us, Jessica.
Glad to be here.
Jessica, I looked at this report about the walkthroughs. I certainly did see a number of problems identified, but we're also talking about a phased-in resumption of in-person learning in the schools. Do you think maybe there's enough time to deal with these problems?
I think that is the big question right now. So we are 2 days away from in-person hybrid learning, and there are still a number of considerations, not just about facilities and air quality and air ventilation, but also about the instructional methods for simultaneous teaching on Thursday and whether that actually is instructionally sound for our students who are both in person and remote. And there are also questions concerning just the number of people who need to go into buildings or not. So if we only have 30 students coming in person, does it make sense to have all 100 staff members still come in? And so there are definitely still concerns with our high needs and high risk, educators who really shouldn't be coming in if they don't need to, and limiting the number of adults and students who are in the schools when we're not entirely sure yet that we have everything we need in our schools to keep everyone safe.
Remote learning by itself is not new, but when you're toggling between remote and in person, get into a little more detail about why this is so difficult.
Right. So if you have been able to participate in remote learning, you'll see that the instruction that is given in remote learning relies on a lot of platforms and activities and FaceTime. And that's very different from the type of instruction that you'd have if you were in person. And so to conduct both remote and in-person teaching at the same time actually is very, very difficult to do because you're actually preparing for twice as much teaching as you normally would. You both have to figure out what students might be doing in person and what students might be doing remotely and keeping track of both. And as you can imagine, no one has figured out how to do this well, except to use very antiquated teaching methods, which is to stand in the front of the classroom and then maybe lecture, but that's actually the worst of both worlds. And so that's why we are really working hard right now to get some flexibility to our schools so they can actually do what makes most sense, both instructionally and to help create differentiated work options for high-risk teachers who otherwise would have to take a leave, but might be able to fully remote teach.
Now, when you say high-risk teachers, I imagine this means people who, for whatever reason, might be more vulnerable to the coronavirus, but who also might be living with family members who are vulnerable.
That's right.
So what should be done with that?
So what we've said from the start and from several months ago actually is to say we need to identify how many students are actually going to be in person in each school and then cohort them in a way in which for some students who are choosing fully remote, that they would then be able to have a teacher who needs to be fully remote because they're, recovering from cancer and immunocompromised or living with someone who is immunocompromised for various reasons or have high risk health conditions. And we'd rather have some folks teaching fully remote in order to keep them than to have them go on leave and then try to hire subs or new people at this point when we've already had 10 days of training. And so those are exactly the kind of accommodations and creative scheduling and cohorts that are both better for students and for having consistency in retaining our experienced veteran teachers who may be high risk.
I want to ask you about ventilation because the broad stroke medical expertise is all you need is one window and one fan, and that should pretty much take care of it. In the Boston schools, there are a lot of windows and they bought a lot of fans. So what else needs to be done to make sure this works?
Right. So again, we have lots of different types of windows. So some of our windows actually only open 3 inches and they don't open up like this, they open out like this. And so how then can the fans be used to try to circulate the air, especially if you have one big room and only one little window that opens 3 inches. Is that really adequate? We're not so sure that it is. And then of course you have some classrooms that don't have any windows, and so they shouldn't be used unless there's an HVAC or air purifier system. And then of course you have some windows that do open and some that don't. And the district is going to replace 7,000 or repair or replace 7,000 windows. But we still have reports of some schools where there are classrooms where the window either doesn't stay open, or there are issues with the fans that were delivered not fitting the right window sizes, and concerns about whether those fans actually are being placed in a way that actually does help with air ventilation, as opposed to just spreading aerosols around the room, which is the opposite of what we need right now.
Well, there are some schools with centralized HVAC systems, and there are others that have at least partially mechanized ventilation systems. But instead of just buying new filters, I guess your walkthrough showed that maybe some of these systems can't handle the necessary filters.
Right. So the recommendation is MERV 13 filters, and there are schools that have HVAC systems that are so old that they actually don't manufacture the MERV 13 filters that would fit in those HVAC systems. The other concern too is that when you have a higher level filter, the HVAC system has to work harder in order to push the air through the filter, because if there's no filter, obviously you can push the air easily through, but if there's a high level filter, then it takes more energy than to push the air through and filter it repeatedly. And so the concerns are that the HVAC systems are so old that they're going to break down. And what happens then when those HVAC systems break down, because they're not able to handle the strain on the system because of the higher filters. And again, we still have HVAC systems where they're so old that MERV 13 filters aren't even made for those systems anymore.
Well, under hybrid learning, most students would be in these buildings just 2 days a week. But with high needs students, they're going to spend more time in buildings, and they're going to be going back pretty soon, I think. So how do you think things look for them at this point?
Yeah, I mean, that is a concern too. We've said all along, our highest need students need to get into safe buildings as soon as possible to get their services and evaluations and compensatory services, et cetera. But right now, we do not feel comfortable, nor do we feel responsible as educators to say, hi, hey, all of our highest need students, many of them who are medically fragile, should be going into schools and be the guinea pigs in places where we have not been able to verify that all the safety measures that need to be in place are in place. And so what we repeatedly said is we've got to identify the safe buildings first and ensure that all students have access to those buildings, as we continue to ensure that all of our school buildings actually can welcome all of our students in, and our highest needs, special needs students should not be the guinea pigs going in first when we haven't had every measure in place yet. And so that continues to be our concern. Again, we want students to come in. We want them to be in person for their services. We know that there's high need students who need a safe place to do work, but it's not going to be safer if the building that they're going to doesn't have everything it needs in order to take all precautions to make sure that it doesn't become a place where they become exposed to the virus too.
In the recent memorandum between the union and the city, I think there is a decision to use a 4% positive test rate as an important dividing line. If it's 4 or higher, I guess there would be all remote learning. If it's below that, you would have at least the hybrid learning. The last figure from the city is that the rate was only 2%, which looks like you're pretty safe, but there are questions about using that as a figure. What do you say?
Yeah, we have concerns about that too, because it's certain neighborhoods that have very low rates that don't have a lot of school-age children that are pulling down the citywide average. And in the neighborhoods where you do have the most school-age children, those are the places where we have more than one place that's over 4% right now. So East Boston consistently has been high. It has gone down significantly from, I think, a high of over 11%, and then I think it's down now to 6%. But then now we have several other neighborhoods that are over 4%. I know 02121, 02125, some of those Dorchester zip codes, and other, I think, Rosendale, Hyde Park are all, in Mattapan are all communities on the cusp too. And that is where a lot of our students are. And we do not have siloed communities there. We have very much citywide transportation and public transportation usage for our high school students too. And so that continues to be a big concern and alarm for us, because we have children and adults going across the city, and we don't want that to be the cause of increased exposure and increased spread.
I want to ask you that because I know the school department has planned, monitoring of students while they're on school buses to make sure they're spread apart and wearing masks. But when you have high school students on the T, and I know the T has signs, telling riders to put on the mask and not to bunch up, but do you think that will be enough with high school students commuting
We
to school?
don't. Absolutely not. No, we don't right now. And that is one of our major concerns too, is the high school students, and again, the a lot of our staff rely on public transportation too, particularly in East Boston. And that doesn't seem sufficient to us. And so we've recommended that our buses actually be providing transportation to our high school students at this point for this year as well. And that's done for the exam schools. It should be done for all of our high schools.
Well, thank you very much for taking the time to join us.
Thank you.
That was Jessica Tang, the president of the Boston Teachers Union. We'll have more news in just a moment.